Artillery fire tore through the darkness. The field surgical station shook violently. The overhead lights flickered. "We've lost power, I can't see anything," shouted the lead surgeon. A young nurse held a flashlight with trembling hands. Her voice breaking, "I can still see the pulse." A shell fragment ripped through the tent wall. The surgeon collapsed. She bit her lip hard, placed her hand on the wounded soldier's chest, and said, "Don't die, I'm not finished with you yet." In smoke and blood, she sutured the aorta alone. The next morning, the soldier survived. He carried the encryption codes that would save the entire unit. Hannah Cole was 22 years old, fresh out of battlefield nursing training, assigned to Afghanistan. As part of NATO's medevac program, she arrived at Forward Operating Base Salerno with her nursing credentials, her father's old military medical bag, and absolutely no field experience. From day one, the other staff made their opinions clear. "You're so small. Can you even handle the sight of real combat injuries?" asked a surgical technician named Martinez. Not unkindly, but not gently either. But Dr. Frederick Kepler, the lead surgeon, who had saved hundreds of lives over 3 tours, was more direct. Trainee nurses observe, they do not lead. They do not make decisions. They follow orders and stay out of the way. Hannah said nothing. She just nodded and got to work. Yet every night after her shift ended, she practiced suturing on scraps of canvas, counting imaginary heartbeats, memorizing the exact placement of every major artery in the human body. She carried something inside her that the others could not see. Her father had been a military medic who died in Iraq when Hannah was 15. His last letter to her, now worn and creased from constant reading, said, "You don't have to be the strongest. You just have to never leave anyone behind." One afternoon, while helping a young soldier named Private Chen bandage a hand injury, he joked nervously, "Your hands are shaking like a baby bird." Hannah smiled despite herself. "As long as I keep you flying, that's all that matters." The other staff overheard and started calling her Chick, some affectionately, others dismissively. That night, artillery fell close to the base. The surgical tent shook so violently that instruments fell from their trays. Most of the staff retreated to the reinforced bunker. Hannah stayed behind, cleaning and reorganizing the scattered surgical tools. Head nurse Patricia Morrison found her there, calmly arranging scalpels by size. "Aren't you afraid?" Morrison asked. Hannah didn't look up from her work. "Of course I'm afraid, but if everyone is afraid at the same time, who saves the people who need saving?" Morrison later told investigators. She always stayed. After every surgery she cleaned the instruments herself. Not because it was her job, but because she said, if the tools weren't perfectly clean, someone could die from infection. "I never saw anyone respect life that much." The soldiers noticed her too. The way she would sit with frightened wounded men, holding their hands and talking them through procedures. The way she never rushed, never showed disgust, never treated anyone as beyond help. Private Chen started a tradition. Every time a wounded soldier was brought in, he would yell, "Get Chick. She'll keep you flying." Dr. Kepler dismissed it as sentimentality. Compassion doesn't save lives. Skill and experience save lives. But the soldiers trusted Hannah in a way they didn't trust the rest of the medical staff. Not because she was more skilled yet, but because they could see she genuinely cared, whether they lived or died. 2 weeks into her deployment, a mortar attack killed 3 soldiers and wounded 7 more. The surgical team worked 14 hours straight. Hannah assisted in every single surgery, never taking a break, never asking for rest. At the end, when the last patient was stabilized, she finally sat down in a corner of the tent, still covered in dried blood, and closed her eyes for just a moment. Dr. Kepler saw her there. For the first time, something shifted in his expression. "You did well today, Cole." "Thank you, sir. Your father was Daniel Cole, wasn't he? I served with him in 2007. Hannah looked up, surprised. "You knew my dad. He saved my life during an ambush. Pulled me out of a burning vehicle while taking fire." Kepler's voice was soft. He talked about his daughter constantly, said, "You were going to be a better medic than he ever was." "I'm trying, sir. I can see that." It was the longest personal conversation they had ever had, and the last one before everything changed. The night before the attack that would define Hannah's life, She stood outside the surgical tent, looking up at the stars. The Afghan sky was breathtakingly clear. When there was no smoke or dust in the air, she whispered a prayer she had learned from her father. Tomorrow let me be brave enough. Let me not leave anyone behind. She had no idea how soon that prayer would be tested. Dawn broke quietly at Forward Operating Base Salerno. The morning patrol left at 6 o'clock. By 7:45 they were ambushed. By 8:20 the base was under sustained artillery fire. By 8:30, the wounded began flooding into the surgical tent. Hannah had been preparing supplies. When the first explosion hit, the shock wave threw her against the supply cabinet. Her ears rang, blood dripped from a cut above her eye. But she got up immediately and moved to her station. As more wounded were rushed in on stretchers, Dr. Kepler was already at the main table, working on the most critical patient. Lieutenant Marcus Ramos, a 28-year-old special operations officer, with a piece of shrapnel in his chest, dangerously close to his heart and aorta. Aortic tear, blood pressure 40 and dropping, shouted the assisting physician. Hannah stood to Kepler's left, holding a blood bag, maintaining pressure on the line. Her face went pale as blood sprayed across her scrubs. Kepler worked with focused intensity, his hand steady despite the circumstances. Suction, more suction. I need to see the vessel wall. Another explosion, closer this time. The entire tent shuddered. The overhead surgical lights swung wildly, casting chaotic shadows across the operating table. Hannah looked up and saw a crack spreading across a tent support beam. Doctor, the structure. I'm aware, Cole. Hold that pressure. Then the lights went out completely. The emergency generators kicked in after 3 seconds. That felt like forever. But one of the surgical lights had been knocked completely off its mount. Someone screamed from across the tent. Another patient going into cardiac arrest. Kepler, 2 more criticals coming in. Morrison called. Dr. Kepler looked up from his patient for a moment, taking in the chaos, the damaged structure, the ongoing artillery fire, the multiple patients all needing immediate care. Hannah saw something in his eyes she had never seen before, fear. Not the normal caution of a surgeon, but deep, paralyzing fear. She would learn later that Kepler had been in a mobile surgical unit that took a direct hit 2 years earlier. He had survived, 3 colleagues had not. He had been diagnosed with PTSD, but kept working, believing he could manage it through willpower alone. The artillery, the collapsing structure, the chaos, it was triggering a flashback. Doctor, Hannah said quietly, we need to continue the repair. Kepler stared at the open chest cavity, at the torn aorta, bleeding faster than they could suction. And his hands began to shake. More blood, we need more blood. He shouted, but his voice was wrong. Panicked rather than commanding. A piece of the damaged ceiling fell, crashing onto a supply table, and sending instruments flying. Dr. Kepler stepped back from the table. I can't see through all this. Doctor, please, we're losing him. Hannah's voice was desperate, but Kepler had frozen completely. He stood with his hands raised, surgical gloves covered in blood, staring at nothing. The other assisting physician looked at Hannah with panicked eyes. What do we do? Hannah looked at Lieutenant Ramos's face. He was unconscious, his skin gray, his pulse barely detectable on the monitor. She thought of her father. She thought of his letter. Never leave anyone behind. Does anyone here know how to repair an aortic tear? Hannah called out loudly. Silence. The other nurses and techs looked at her with frightened, helpless expressions. Hannah made a decision that would either save a life or end her career. Hold the flashlight steady. I can still see the pulse. Doc Cole, what are you doing? Stammered the assisting physician. My job. Now hold that light steady, so I can see what I'm doing. Her hands were shaking so badly she could barely thread the needle, but she had practiced this 1,000 times on canvas, on simulation models, on every quiet night when she couldn't sleep. She knew the theory, she knew the anatomy. She had watched Dr. Kepler perform this exact procedure 3 times. She bent over. Lieutenant Ramos took a deep breath and began to suture. You can't do this, someone shouted. You're not authorized. Then call someone who is. Hannah snapped back. But until they get here, I'm all he's got. The artillery fire continued outside. The tent shook, blood pooled on the floor around her feet. Hannah blocked it all out. There was only the needle, the thread, and the torn vessel. That had to be closed before this soldier bled out. Her hands stopped shaking. Muscle memory took over. Suture, tie. Suture, tie. Each stitch had to be perfect. Too loose and it would tear. Too tight and it would restrict blood flow. His pressure is coming up, said the assisting physician, voice filled with disbelief. Hannah, it's working. Keep the blood going and someone check on Dr. Kepler. She completed the vascular repair in 12 minutes. It should have taken an experienced surgeon 20. Under these conditions, when the last suture was tied, and the repair complete, Hannah stepped back, looked at the heart monitor showing a steadying rhythm, and then collapsed to her knees. Her hands were shaking again. Her whole body was shaking. She had just performed surgery she had no authorization to perform. On a dying patient, in the middle of an artillery attack. She had either saved his life, or destroyed her own career. Possibly both. The artillery fire finally stopped. In the sudden quiet, the heart monitor sounded impossibly loud. A soldier burst through the tent entrance. Is Ramos alive? Everyone turned. Because if he's dead, we're all in serious trouble. He's carrying the satellite authentication codes for the base defense system. The tent went absolutely silent. They hadn't known, none of them had known, that Lieutenant Ramos wasn't just another wounded soldier. He carried information that could determine whether the entire base survived the next attack. Hannah, still on her knees on the blood-covered floor, started to laugh. It was a slightly hysterical sound, but she couldn't help it. He's alive, she finally managed to say. He's going to make it. The formal investigation began. 48 hours after the attack, Hannah sat in a small office, facing 3 senior officers and 2 medical review board members. Dr. Kepler was being evaluated separately, undergoing mandatory psychological assessment. Nurse Cole, Colonel Davidson began, his voice formal and cold. Can you explain to this board why you performed surgery without authorization, without supervision, and without the qualifications to do so? Hannah kept her hands folded in her lap to hide the shaking. Sir, Dr. Kepler was incapacitated. Lieutenant Ramos was bleeding out. No other qualified surgeon was available. I assessed that taking action gave him a chance of survival, while waiting guaranteed his death. That is not your assessment to make. Another officer interjected sharply. You are a trainee. You have neither the authority nor the expertise to make those decisions. Then what should I have done, sir? Let him die while I waited for someone with authority. You should have stabilized him and waited for proper medical personnel. There was no time to stabilize. The aortic tear was expanding. In another 90 seconds he would have been beyond saving. The review board members whispered to each other. One of them, a female colonel with a medical background, spoke up. For the record, we have reviewed the surgical report. The vascular repair was technically proficient. Had a senior surgeon performed the same procedure, under those circumstances, we would be recommending them for a commendation. But she is not a senior surgeon. Davidson replied. She is a 22-year-old nurse, with 6 weeks of field experience. What she accomplished is either remarkably lucky, or remarkably skilled. I am inclined to think it is the latter. The investigation lasted a week. During that time Hannah was confined to base, suspended from medical duties pending the outcome. The story spread through the camp like wildfire. Trainee nurse performed battlefield surgery during artillery attack. Saves special operations officer carrying critical codes. Reactions were divided. Some soldiers called her a hero. Others said she was reckless, dangerous, a liability who had gotten lucky. Lieutenant Ramos remained unconscious for 5 days. When he finally woke, the first thing he wrote on a notepad was, "Where's Chick?" They brought Hannah to his bedside. Ramos's hands were too weak to write much, but he managed. "Thank you. You saved all of us." Hannah's eyes filled with tears. "I'm glad you're okay, sir. Heard you went rogue on them." "Good. Someone had to." The technical medical report confirmed what the review board had suspected. The sutures were perfect, placed exactly where they needed to be, with exactly the right tension. The repair was textbook quality, performed under impossible conditions. Dr. Kepler was transferred to Germany for treatment. Before he left, he asked to speak with Hannah one final time. They met in the hospital wing. Kepler, looking older and more tired than she had ever seen him. "I failed you," he said. Without preamble. I failed Ramos. I failed everyone. Sir, you have saved hundreds of lives. One moment of trauma response does not erase that. But it could have cost lives if you hadn't stepped in. He looked at her directly. Why did you do it, Cole? You had to know the consequences. You could have been court-martialed. Hannah thought about how to answer. Because I remembered why I became a nurse. Not for the credentials or the authority. Because when someone is dying, credentials don't matter, only action does. Kepler nodded slowly. I forgot that somewhere along the way. I started believing my experience and my reputation were what made me a good surgeon. But you reminded me, it's not about who you are. It's about what you do when everything is falling apart. He reached into his bag and pulled out something Hannah recognized immediately. Her father's military medical insignia, which Kepler had kept since the day Daniel Cole saved his life. Your father gave me this after he pulled me from that burning vehicle. He said, pass it on to someone who understands that medicine is about courage, not credentials. I think he would want you to have it. Hannah accepted the insignia with shaking hands, unable to speak through her tears. A week later the formal findings were released. The disciplinary action against Hannah was dropped. Instead, NATO command issued a statement, acknowledging her actions as extraordinary conduct, under extreme circumstances, exceeding normal authority, to preserve life and mission-critical assets. But the real revelation came from the subsequent intelligence briefing. Lieutenant Ramos had not just been carrying authentication codes. He had been returning from a covert operation that had intercepted communications about a planned major offensive against multiple NATO bases. The timing codes he carried were essential for coordinating defensive measures. If Ramos had died, the codes would have died with him, compromising the defense of over 300 soldiers across 4 bases. Hannah's split-second decision to act, to violate protocol, and perform surgery she was not authorized for, had inadvertently prevented a much larger catastrophe. The soldier who had burst into the tent that day came to see her. His name was Sergeant William Torres, and he had been part of Ramos's team. You need to understand something, Torres said. When I ran into that tent and asked if Ramos was alive, I didn't know whether you had saved him or not. But I knew that if he was dead, a lot of good people were going to die. Because we wouldn't be able to coordinate our defenses. I didn't know that when I operated. Hannah replied. I just saw a soldier who needed help. That's why what you did matters. You didn't save him because he was strategically important. You saved him because he was human. That is the kind of medic every soldier hopes for. If they go down, the attitude of the other medical staff shifted. The nickname, Chick, went from dismissive to a term of respect. Soldiers began requesting Hannah specifically when they needed medical care. But the most powerful moment came during a staff meeting. 2 weeks after the incident, Dr. Kepler, back from Germany, addressed the entire medical team. His voice was steady but filled with emotion. I want to apologize to all of you, but especially to Nurse Cole. I froze when action was required. My PTSD, my pride, my fear, they all got in the way of doing my job. Meanwhile, a trainee nurse with 6 weeks of experience did what I could not. She acted. He looked directly at Hannah. You are not just a good nurse, Cole. You are the kind of medical professional I aspired to be. When I started, you reminded me that courage is not flaunted. It is about refusing to give up, even when you are terrified. Hannah stood at attention, unsure how to respond. You saved a life that night. You may have saved hundreds. But more importantly, you showed everyone here what it means to be a healer. To act when others freeze. To step forward when others step back. The room was silent. Then one person started clapping. Then another. Within seconds, the entire medical staff was applauding. Hannah stood there, overwhelmed, thinking about her father, and wondering if he could see this moment. If he knew his daughter had done exactly what he had taught her, never leave anyone behind. The story of the rookie nurse, who performed battlefield surgery, spread far beyond forward operating base Salerno. Within the military medical community, Hannah Cole became known as the Angel of Helmand, a nickname that stuck, despite her protests, that she had simply done what needed to be done. Young medics and nurses in training began asking, specifically about her techniques, her decision-making process, Her ability to remain calm under extreme pressure. Hannah found herself, reluctantly at first, teaching what she had learned. She developed a training protocol she called Drill 30. 30-second scenarios, where trainees had to make critical decisions. Without supervision, without backup, without perfect information. In real combat medicine, she would explain, you won't have time to consult a supervisor. You won't have perfect conditions. You'll have 30 seconds to decide whether to act or wait. This drill teaches you to trust your training, even when you are terrified. Dr. Kepler, having properly treated his PTSD, returned to teaching. His approach had changed fundamentally. I spent years teaching you to follow protocols, to rely on experience, to wait for proper authorization, he told a class of new medical officers. But Nurse Cole taught me something more important. Protocols are meaningless if the patient dies while you are following them. Sometimes the most important thing you can do is act. He paused and looked at Hannah, who was sitting at the back of the classroom. Courage is contagious. When one person refuses to freeze, others find their own courage. That is the real lesson of that night. The surgical tent where the incident occurred was rebuilt and renamed. A plaque was installed that read, in honor of Nurse Hannah Cole, who stepped forward when everyone froze. But the most profound changes happened quietly. In individual conversations, in small moments. A young combat medic named Sarah Chen approached Hannah after a training session. I've been having panic attacks before surgeries. I'm afraid I'll freeze like Dr. Kepler did. What if I fail someone when they need me most? Hannah looked at the frightened young medic and saw herself 6 months earlier. Fear doesn't make you weak. Fear makes you human. The question isn't whether you'll be afraid. It's whether you'll act despite being afraid. But what if I make the wrong choice? Then you make it while trying to save a life, not while standing frozen and doing nothing. I would rather fail trying than succeed at staying safe while someone dies. Chen nodded slowly. I think I understand. Stories began circulating among the soldiers, not just about Hannah's surgery, but about smaller moments that revealed her character. Private Chen, the soldier who had first called her Chick, told anyone who would listen. I watched her sit with a dying soldier for 3 hours once, holding his hand and talking to him about his hometown. Even though she knew he wouldn't make it, she didn't give up on him. She didn't treat him like he was already gone. That's who she is. A helicopter pilot named Rachel Morrison recounted. My co-pilot was injured during an emergency landing. By the time Hannah got to us, he had lost a lot of blood. She kept working on him, kept talking to him, kept fighting for him. She told him, I didn't come all this way to let you quit on me now. He survived. He's back flying missions. The Drill 30 Inches training protocol was adopted by multiple NATO medical units. It became part of the standard battlefield medicine curriculum, teaching an entire generation of medics that sometimes acting without authorization is exactly what the situation demands. 6 months after the incident, a formal ceremony was held at the base. Lieutenant Ramos, fully recovered, stood before an assembly of soldiers and medical staff to give a speech. When I was on that table dying, I didn't know who was saving me. I didn't know if it was a surgeon or a nurse, or what their credentials were. All I knew was that someone refused to give up on me. He looked directly at Hannah, who stood in the back row in dress uniform, uncomfortable with the attention. Nurse Cole didn't save me because I was strategically important. She didn't know about the codes. She saved me because I was a human being who deserved a chance to live. That is the kind of medical care every soldier deserves. That is the kind of courage we should all aspire to. He walked over to her and presented a Special Operations Unit patch with the inscription, Chick, the one who didn't run. Hannah accepted it with trembling hands, her eyes wet. I was terrified. She admitted quietly, I'm still terrified, but you learn to be afraid and still act. Ramos replied, that is the only courage that matters. Hannah Cole completed her deployment and returned to the United States. 8 months after the incident that had defined her career, she was offered positions at prestigious military hospitals, opportunities to teach at medical schools, chances to advance rapidly through the ranks. She declined most of them. Instead, she requested assignment to military combat trauma training, teaching the next generation of battlefield medics. I don't want an office. She explained to her commanding officer. I want to make sure that the next time a young medic faces an impossible situation, they'll remember that someone like them managed to figure it out. At the ceremony marking the end of her deployment, soldiers lined up to thank her. Some were men and women she had treated. Others were people who had simply heard her story and found courage in it. One young nurse, fresh out of training, approached nervously. I'm assigned to your old unit. Everyone keeps telling me about you. I'm afraid I won't be able to live up to that. Hannah smiled gently. Don't try to live up to me. I was terrified that entire night. I had no idea if what I was doing would work. I just knew that doing nothing was worse than trying. But you saved his life. I tried to save his life. That's all any of us can do. Try with everything we have. Trust our training, and refuse to give up. The young nurse nodded, looking slightly less afraid. Before leaving Afghanistan, Hannah visited the memorial wall, where fallen soldiers were honored. Among the names was her father's, added when he died years ago saving others. She stood there for a long time, her hand pressed against his name. I didn't leave anyone behind, Dad, she whispered, just like you taught me. Back home, the story continued to spread. Medical journals published case studies of her emergency surgery. Ethics boards debated whether she had made the right choice. Training programs analyzed her decision-making process. But for Hannah, the most meaningful moment came in a letter she received 3 months after returning home. It was from Dr. Kepler. Hannah, I'm writing to tell you that I have completed my PTSD treatment and returned to surgery. My first procedure back was a routine appendectomy. Nothing dramatic, but halfway through I felt panic rising. I could feel myself starting to freeze. Then I remembered you. I remembered a 22-year-old nurse who acted when I could not, who trusted her training when I lost faith in mine. I thought, if she can repair an aorta during an artillery attack, without authorization and with a flashlight, I can handle a simple appendectomy. In a well-equipped operating room, I finished the surgery. The patient recovered. You saved Lieutenant Ramos that night. But you also saved me. You reminded me why I became a surgeon in the first place. I'm teaching again now, but differently. I tell every student about you. About courage that doesn't wait for permission. About the importance of acting when everyone else is frozen. Thank you for being brave enough to move when I could not. Frederick. Hannah folded the letter carefully and placed it in the box where she kept her father's insignia, Lieutenant Ramos's unit patch, and the worn gloves she had worn during that surgery. Her father's letter was there too. The one that said she didn't need to be the strongest, only that she could not leave anyone behind. She had kept that promise, and in doing so, she had discovered something her father had known all along. Courage is not about not being afraid. Courage is not about being the most skilled or the most experienced. Courage is about who moves first when everyone else is frozen. And sometimes, that is enough to save the world. If you believe stories of ordinary people finding extraordinary courage deserve to be told, please comment and subscribe to SN Touching Stories. We share the stories that should never be forgotten. Tales of split-second decisions, of people who act when others freeze, and of courage that changes everything. Because sometimes, the most important question is not whether you have permission to act,